in today's session? Wonderful, thank you, Emily. And Emily has got a beautiful background for February, but is not on screen today. She's a little under the weather, so Emily, we're missing out on the February background, but thank you for keeping
That's
us all. Thank you for keeping us all together on the slide. So first activity, I guess this is an icebreaker. If you had to eat breakfast anywhere in the world, where would it be? And as you all enter your answers, we should start to see them populate on this map. Paris. Not a lot of people want to be in the States right now. The weather is kind of crazy. Italy. I think that's Hawaii over there. Yep. New Zealand. I've never been to New Zealand. Show of hands, anybody been to New Zealand? A lot of head shakes. Turks and Caicos. Beach people. Me, I like big cities. That would be my vacation. This is great. I love this. Very cool. Well, thank you all for participating. I hope you liked this icebreaker. We'll try and keep things going for the rest of the year. Emily is definitely more creative than I am, so she'll keep the creative juices flowing with different icebreakers in each of our monthly sessions. Agenda for today, really quick. We're going to kind of do an instant replay of January. I'm going to hand the mic over to Sokim. Sokim's going to spend some time going through some CalAIM updates. And then we're going to tee things up for our brainstorming breakout session. So we're going to talk a little bit more. We did this in January, but we're going to talk a little bit more about QI, or quality improvement methodology, and the activity that we'll be doing when we break out into our different rooms. After that, we'll come back together and kind of share our thoughts. And we'll talk a little bit about next steps, what to expect around communications, different handouts and materials that we'll share between now and our next meeting. All right. Now that we've gone over our agenda, we're going to introduce a new member of the team. Mariah, who's here with us today, is going to be our co-facilitator. Mariah is already working in another county in Contra Costa, and she's also going to be working as a co-facilitator for San Diego. So welcome, Mariah. And you see me on the screen, and Sokim as well. Sokim was with us in January and is going to continue to be our expert in everything CalAIM and probably more. So we're excited for Sokim to continue to share feedback on different aspects of CalAIM as the year unfolds. And Emily is going to keep us honest and on time and on schedule and have everything working as it should. So Emily, I appreciate you making all of this happen today. Thank you so much. Last month, we spent some time talking about collaborative agreements. What do we want to hold ourselves to? We're going to be working together for a year, and you all have been working together for many years. So these are some things to just kind of guide our discussions in these meetings. You know, as we keep working together and break out into smaller groups and work through some of the challenges that exist and some of the great work that's been done that you want to improve in the community, these are our guiding principles for the way that we're going to engage with each other. So we had, thanks to Health Leads, some core collaborative agreements. And in our January session, we voted on some additional collaborative agreements that we wanted to kind of hold ourselves to. So this is the list of that. Each of these has a little narrative. So part of one of the handouts that you'll have, and we'll also keep it posted on our website, is the collaborative agreements, including the narrative. And we'll also have this slide in every presentation moving forward as a reminder of the things that we're going to hold ourselves to as we continue to work together. If you have any questions as we go along, please feel free to add them in the chat. And we will also, you know, if we can, we might call on you if we have any questions about your question. If for whatever reason we don't get to something today, all of this will be here. We'll save the chat, and then we'll make sure that we respond to those questions. Hopefully we'll be able to get it through everything today. Instant replay. So in our first session, our kickoff session, we talked a little bit about the purpose of the collaborative, you know, who we are as a group, and what work do we really kind of want to look at achieving together as a team, and also maybe what we're not. So part of the PATH CPI collaborative and some of the transitions from previous PATH collaboratives, yes, several implementation issues have already been identified. Yes, absolutely. And I'm just kind of reading through. We'll go ahead and address that question. I'm just trying to read through it right now. So absolutely implementation issues associated with ECM and CS, and then also the framework of these meetings. So we wanted to kind of make sure that we were really clear about what the purpose was of our collaboration together. And then also the things that we're not. We want to make sure that we're not only addressing funding, we're not only addressing issues, we're also looking at things as opportunities and what we can do to look at infrastructure and support and how we can collaborate to support one another. So we'll be spending our time addressing all of those things. Go ahead in the next slide. All right, I'm going to kick things over to Sokim. Sokim's going to talk us through some CalAIM updates for today.
Yes, thanks, Denise. So hello, everyone. Good morning. I'm going to spend a few minutes going over CalAIM. We have a large group here, and with different levels of knowledge and understanding around the CalAIM initiative. So we're just going to do a quick overview and then and share some high-level information about the different funding opportunities, how the different funding opportunities fit in with what we're trying to do here in the collaborative, and also some statistics that DHCS has gathered so far, you know, with the implementation. And this is all to help with level setting as we have discussions and identify objectives for this group. CalAIM, sorry, just one slide. Yeah, CalAIM stands for California Advancing and Innovating Medi-Cal. And basically what CalAIM is a big transformation of the Medi-Cal program so that it's more equitable, comprehensive, and person-centered. And it's also intended to help make the Medi-Cal system more consistent, efficient, and seamless. So those are the primary goals that the different initiatives under CalAIM are based upon. And so that's you know, that's why we're all here. It's all focused around the objectives that have been identified by DHCS under CalAIM. So next slide. So there are a lot of different updates under CalAIM, but these are the ones that we're identifying now that we believe are most relevant. If there's anything that that you have identified as important to your organization or you think is relevant for this group, please let us know and we'll continue to share as much knowledge as possible. So a few a few developments, important developments to share. There's an initiative within the CalAIM program that is supporting the collaborative work that we're doing, and it's around technical assistance. And so DHCS, along with the third-party administrator who is administering some of these programs, have set up a technical assistance marketplace, and that has gone live. And it's essentially a place for all of the ground level providers and community partners to leverage resources and technical assistance to implement enhanced care management and community support services, which are two key areas of CalAIM. And then we'll in a couple of slides, we'll show you where you can start the process for registering for technical assistance and identifying what support you need. But that's now live. The other initiative within CalAIM is called Cited, and that's to help with capacity and infrastructure support. And so there was the last year, the first round of funding, the application window for the Cited funding took place last year, and DHCS has announced the awardees in January, and there's a remainder of awardees that they'll announce in March. There's a round 2 application window that's going to open up in a few days on the 28th. So if your organization would like support around capacity and infrastructure development, this is the funding opportunity that you would pursue. And there's also another funding opportunity that's focused on the Justice Involved services. That's another component of CalAIM, and they're also in their round 2 application window, and that will close in end of March.
Sogan,
Yes.
can I just wanted to call out in the chat that somebody wanted to inform the group that DHCS is having a webinar on Cited funding on March 3rd.
That's correct. Yes, on March 3rd, I believe between 10 to 11. So we can forward that link for the registration as well. So there have been some questions among this collaborative and among other communities that we've engaged with around, what are the different funding opportunities under CalAIM and how do they fit together? So I'm going to spend a little bit of time on this infographic that hopefully gives you a better idea of what the different initiatives are and how they're tied to CalAIM and how they relate to each other. So you should have access to this in the chat, and we'll also send a copy of this after the meeting as well. So as you see, right in the center are the CalAIM goals that I skimmed through on an earlier slide that is focused around implementing a program that's focused on whole person care and provides improved quality outcomes and reduced health disparities, and also makes the Medi-Cal program function more seamlessly and efficiently. So those are the threefold primary goals of CalAIM. And all of these gray images around the CalAIM goals are all the different initiatives that you may have heard about. And they all support different types of services. You'll see there's one around behavioral health, there's one around the homelessness population, and there's also one around population health management services. The ones that are directly relevant to the work that we're doing here are the ones highlighted in blue, which is IPP, which is relevant to the managed care plans. That's the incentive payment program that incentivizes managed care plans to implement and provide enhanced care management and community support services. And that's focused on supporting managed care plans. And then there's supporting everyone else in the community who is going to deliver ECM and community support. So if we scroll down, you'll see under ECM and community supports for the non-managed care provider entities, there are different initiatives. CPI is the work that we're doing now with the collaborative. And I mentioned the cited funding, which is funding to support capacity and infrastructure building. So it's just the people and the technology and the data. And then TA, the technical assistance, is being able to operationalize the work to be able to deliver ECM and community supports. And then there's the justice involved funding opportunity as well. And that all fits under PATH. So, so hopefully this helps, provide a good overview of all the different pieces and how they're connected to each other. There are nuances to each of these. So this is just intended to, to help with that overview. But if you have any specific questions or specific situations to your organization, please feel free to reach out. And we're happy to bring more knowledge and focus on certain areas of CalAIM or the PATH funding opportunity as the group, identifies and is needed. So we'll incorporate it based on what you all are interested in. So DHCS did share out some statistics on the implementation of ECM and community support so far. I'll highlight a couple of statistics that might be interesting, in terms of the number of members enrolled in ECM since the CalAIM went live. So there, you'll see that initially in Q1 of 2022, most of the members were from health home programs and whole person care programs and who enrolled in ECM. And that has declined over time into Q2 because there was less need for those services. And then the number of newly enrolled members went up over time. And similarly, for members receiving community supports, there were a lot of members who were receiving whole person care services, and that also declined over time in terms of those members receiving community support services for the same reason that they are required less of those services and because they stabilized. So those are just a couple of the statistics that is in the ECM and community support fact sheet. If you will just give you a snapshot of what that 4-page info sheet looks like. So feel free to browse through it. It has information about the ECM and community support providers and also data on the members that have been enrolled in those services and some demographic information if you're interested as well. So I see any local San Diego County data to share. Yes, so we can, we can bring that information. It's not in any of the data that's in this info sheet. It's statewide. So we can pull in data specific to San Diego. So obviously that's going to be relevant for our conversations. I'll touch on one other thing. And if you have any questions, feel free to put them in the chat and we'll make sure to address them. I just want to show a screenshot of what the TA Marketplace registration site looks like. So we'll send you the link to this page so that you can register and browse through the different TA services and resources that are available for your organizations and your community partners. So, all right, so that's the overview of Kelly that we wanted to share. Again, if you have any specific areas that you want us to touch on in the future, please let us know.
Thank you so much, Sokim. The other thing that we want to try and do, that we will do in our monthly meetings is call on all of you to share other feedback as well as it relates to things that are happening in the county. So, you know, for the IPP funding and for a lot of the other initiatives, we'll be able to work with community partners to share out. So similarly, for those of the participants that were part of the San Diego Healthy San Diego Roundtable and the IPP discussions, we want to make sure that we have enough time for sharing that information with the community partners as well. I'm going to just get us, I'll go through, I'm seeing the questions pop up. I'm sorry, I'm trying to read through some of them so that I can say them out loud while I'm talking, but I better stop. We'll go through a breakdown of QI methodology in preparation for our breakout session today. We'll spend about 30 minutes in our breakout session activity. So we'll start with your level of familiarity with quality improvement methodology. So next poll question is, how familiar are you with quality improvement methodology principles? This is great. This is great to see. It means that we're going to have excellent conversation in our breakout sessions. So for those of you that are slightly familiar, we'll just kind of talk through really quick some of the principles around QI methodology and what we'll do to get ourselves ready for the breakout session today. I love that nobody's not at all familiar. That is very helpful. So I don't need to tell you then at least what QI methodology is. We did put this in our first slide. But for today's breakout session, we're going to be talking about our aim statement. And this isn't something that's finite and has to be how the PATH Collaborative moves forward. It's really just something that will help sort of center us and ground us in the work activities that we want to do. And to Nancy's earlier question around issues that exist in the community, it's really going to be a way for us to kind of shape how we address those issues together as a group. And so it's really kind of what we'll use as our sort of guiding principle. For today's activity, our aim statement will have a 4-part structure. And we have on the screen sort of what those 4 parts are: the who, the when, the what, and by how much. So the biggest part of the way that we think about an aim statement and maybe what makes it different than a goal or a wildly important goal or something that's maybe more vague in what we're trying to achieve. This kind of gives us a nice framework and infrastructure for things that we want to look into, things that we might want to measure, things that we know that we want to change, but how we want to change them. So it helps us really think about some of the issues in a different way. And so we have some additional resources for QI methodology, and those are available. We'll send them out again in our materials after today's meeting. But that's really the whole part of the breakout session. So really thinking about some of these issues in a more granular way and how we might be able to measure changes that we make to address some of those issues. So on the page is an example, and I'll kind of tear apart a little bit the example that we have here and some of the other feedback that I saw in the chat. which is how do you kind of put together an aim statement without a baseline? And I think that's a very valid question. So there's some questions around getting some regional and county numbers. I think that's absolutely something that we want to work towards. It's something that's been addressed previously in some of the feedback that you all have shared. And we need to continue to do that. We can also work to build a goal and an aim around that, which is maybe to achieve some benchmarks or to achieve a baseline, to actually get that information, and then to evaluate that information and increase, in this case, the example, the number of beneficiaries enrolled by a certain percentage. And we want you to think about today's exercise is not, again, not finite. We really just want to be a little bit more concise around some of the work that we're doing, and we want to help that sort of frame up continued conversations. Okay, Emily, next slide. So we also wanted to share with you all some of the feedback that you gave to us in the survey that we sent out initially, and some of the registration feedback. We asked 3 factors that the collaborative wants to focus on. And my body is blending into the mountains and ocean behind me. The 3 most answered are data integration. So really thinking about data integration with your own organization, data integration and sharing, and ways that that information can be shared with other community partners, maybe referrals or other types of exchanges, maybe tied to the data exchange framework. The other one was increasing the number of beneficiaries receiving services. That's a big deal. And it also is one that we want to try and get a baseline. I know that some feedback that I was given is that there's some not necessarily confirmed percentages. And so we might want to get a confirmation on the current percentage of beneficiaries receiving services and think through how we might want to increase that. Last but not least is data standardization. The more that we look at things at a county level, at a region, a statewide population level, data standardization is critical to really looking at addressing things that are impacting populations. And so that was the third factor that the group shared that they were looking at improving. So we wanted to share those back with you in case they made a difference in your breakout session discussions. And then I think the next is sort of just what we will get ourselves into today. So breakout room instructions. We're going to do about 30 minutes in the breakout room. When you guys get into your breakout rooms, we'll ask you to maybe spend a little bit more time on introductions. It's hard, like I said, with a big group like ours, to spend some time getting to know each other in these monthly meetings. So please take the time to do some introductions if you don't all already know each other in your breakout room. I'm also going to ask you to delegate a group scribe and a group presenter. So somebody in the group, after the group adjourns, is going to message Emily, and she's one of our co-hosts today. You're going to message Emily and you're going to share with her 2 things. You're going to share with her the aim statement that your group came up with. And you're also going to share with her your vote for the best background. In addition to that, we're going to come back together and we're going to ask each of the group presenters to share what the group came up with as their aim statement, and maybe some of the why behind coming up with that statement. Okay, we'll address any questions. Thank you, Emily, for putting that in the chat. We'll address any questions as they come throughout. The folks that are co-hosts today will pop in and out of the breakout sessions. Make sure that if we are available to answer any questions you have. And if you do have any questions and you don't see one of us entering your breakout room, you can hit that little question mark in the breakout room and it will automatically ping us to let us know that you have some questions. All right. With that, let's go ahead and get started in our breakout room. I feel like I need to do a drum roll. Medium. Some thumbs up, I see. Okay. It never feels like enough time. I could have used in the breakout session that I was in 5 more minutes, 10 more minutes, maybe even a half an hour. I think it was a good exercise to really help us understand some things that the county and the community are doing really well, and some of the things that we want to address together as a collaborative. And some of it is even just creating clarity where there's confusion. And so I'm gonna try and be as mindful about time as possible. I know that we want to share our aim statement. And so for the teams that didn't come up with something concise, that's okay. If you can share maybe 3 items specifically that you and your group focused on, that would be great. And you can message those to Emily. To message a direct chat, if you don't know how, you just click that little drop down. If you don't even want to deal with it, feel free to message everyone. Emily will grab it and get it into the document for us all to look at. I'm going to call on each of the groups. I don't know, Mariah, Sokim, Danny, if you can help me with that. I don't know if we didn't have group names, so I'm not even sure what number our group was. So note for next time.
I can call on someone. Jackie, can I call on to be the first?
Unbelievable.
really- you guys had such good discussions and we're really, getting close to a good aim statement. So
Okay.
you'll set the bar high, but no, don't feel the
I
pressure.
hope so.
Good.
Okay, so from the 3 measures or the 3 items that were shared before we went into our breakout rooms, we decided to focus on data standardization. And our aim statement is the San Diego County Path CPI Collaborative will develop data standardization metrics for implementation of a universal health risk assessment and care plan by September 30th, 2023.
Aggressive. I like it.
Thanks, Jackie.
Of course.
And team.
September 30th. Yeah, I know. Ahead of the game.
Jackie,
That's
can
it.
you share that with me, what you have written out there so I can include it in our activity?
Sure.
And as you're sharing, Claudia, can I call on you to share out some of what our group talked about?
Sure. I was just in the process of polishing up, but that's okay, right? Safe space. All right, so we discussed some engagement and retention with our beneficiaries, ensuring equal access to CalAIM, also having an equitable approach so that clients being served match demographic breakdowns of those experiencing homelessness and increasing enrollment and retention rates. Also, an element of quality of care delivery, ensuring that beneficiaries are receiving quality services and understanding the overall landscape of what's happening through data sharing and funding opportunities to ensure that there isn't duplication of services and just having a more solid understanding.
Thank you
Thank
for
you so
sharing.
much. Any other group willing to go next in their share?
Yeah, I can share for group 4. I can say that our process, we were focused on data and wanting to have San Diego data from 2022. So we had a significant urge to make that our primary aim and to focus on action since we've kind of been at this for some time. So what we came up with, that is a part of it with kind of a higher level goal. So the San Diego County Path CPI Collaborative will increase the number of beneficiaries enrolled, engaged, and successfully billed for by 10%, random number, through providing high quality services that are data driven, linguistically and culturally appropriate by insert date.
That's great.
Mary, thank you so much for sharing. Emily, do we have them all? Do you have something from everybody?
Yes, so 1 second, let me save.
Take your time. While you're doing that, can we call on another group to share?
I can go. I don't know our group number, but I'm happy to go.
All right, Stephanie, you go, and then Jenna, you're next.
Okay. So our group focused on standardization, and our statement is develop and standardize referral, authorization, and claims forms, documentation, and processes between service providers and managed care plans by December 31st, 2023.
Wonderful. Thank you so much. Standardization is the thing. Yeah.
Yeah, I should just say ditto. Our group basically landed on the same thing. I think as one part of it, we didn't come up with like a statement, but also said data exchange. So we really focused for San Diego on standardization and data and information exchange. And then we also talked about like big picture is how our collaborative, and if we can all collectively with other collaboratives throughout different counties, come up with or elevate what's working and what's not working, we can have a stronger voice for making change that can benefit all of California, and also learn like if other counties are doing something that's working well, there's something perhaps that we should be adopting here as well.
Thank you so much for sharing, Jenna. Anybody not share yet?
I can share. I think we were group 7, and Kathleen, you can jump in if I miss anything. We focused on actually 2. We were very eager and called them stretch goals on the data integration because it was such a high focus, and on the percentage of enrollments. So our statement is the San Diego Path CPI Collaborative will double the number of data system integrations in the community information exchange and the health information exchange, and double the number of beneficiaries in ECM and community supports by 12/31/2023.
Awesome. Thank you so much, Kimmy, for sharing.
Denise, I can share on behalf of Group 3.
Thank you,
And
Heather.
we're made up primarily of ECM direct service providers and really focused around referrals. And the ECM providers were also talking about some difficulties in referring to community support providers and not necessarily knowing who those partners are. But we said that the San Diego Path CPI Collaborative will work with CIE to serve as the single referral. Prior authorization was a stretch goal, and prior authorization platform for two-way communication between ECM, CS, and managed care plan partners by December 31st.
Thank you so much, Heather, for sharing.
And this is Jen. I just have to say we had a managed care plan person on our team who like kept us on track, and we're like, is this realistic? Is this isn't, you know? So we tried to just stay collaborative there.
I can provide some information on Team 6.
Thank you, Joe. Yeah, that would be great.
So we kind of wanted to take a step back and kind of elevate the discussion. So the top priority for our team was to see what we can collectively do to become a better collaborative. The teams determined that there's a need for additional clarity on goals and objectives, a need for additional information on available program resources. And so how we could best integrate across programs and integrate across the various resources to better serve the community members. And this included a better understanding of the funding, the PATH funding that's been provided across San Diego to date, and to identify, really what the funding is supporting, and to basically do, if we could, a bit of a needs assessment so that we understood better really what is taking place and how can we better fill the gaps and support the community members that we're collectively serving.
That's wonderful, Joe. Thank you so much for sharing.
Thank you.
And I see here, so just if anybody's willing to share any additional notes from the group work that you did, please feel free to share those with Emily. We'll go ahead and try to keep everything together and put it and add it to our meeting minutes so that we can share and be as transparent as possible. So please, if you have anything that you were jotting down in your groups, even if it's sort of my notes are terrible and my handwriting is even worse. So it doesn't have to be anything spectacular, but the more information you can share, the more we can make sure that it gets redisseminated to the group at large. I know we only have about 10 minutes left. It doesn't seem like we had enough time, and yet I know you all invested an hour and a half on a Friday, nonetheless. So I just want to acknowledge what you're seeing on the screen, which is the voting amongst yourselves of some of the topics that we just went in and reported out. It's looking like a pretty even number around the AIM statements, maybe around 15 to 20% in those 4, brown, blue, or yellow, and green. What we'll do is take this back and we'll share this with you along with the recording. And maybe what we can do is propose something that might maybe include all of them or aspects of them, and then share them back with you and see if that makes some sense.
Well-
Or maybe what we could try and do is prioritize certain activities based on some of the voting. Stephanie, I see you've raised your hand.
Well, so to that, what's kind of is striking me as I'm looking at this, it's almost like if you look at the 20% that's the highest, well, that just changed to 19 and 19. But if you look at that increasing the integration, part of the other statements are action, I feel, the action steps really toward that coming to fruition. So, I think it's all pretty interconnected. And so that's just what struck me as I was looking at all of this.
Yeah, same here, same here. And I think that's what will be most helpful as we look at maybe trying to include them all. Other path CPIs, just so you know, have more than one aim statement. I don't want to overcommit ourselves as a group, because maybe then we won't get this good work done that we really want to get done. But I think it's important for us to acknowledge that we have these things as priorities. I'm gonna move us into a one fun activity and talk a little bit about next steps. Because we only have a few minutes left. We absolutely didn't have enough time for questions. We didn't have enough time for announcements. But we're gonna make time for group announcements in our future meetings. So I will work with Emily to send out an agenda. And we'll make sure that we carve out a certain number of minutes in our next meeting for just group shares. We'll probably do a breakout session again if you all think it was good. We're going to send you a survey today. So tell us what you think, good, bad, or otherwise. All of the information is helpful, and it's used to make sure that we're doing our job to the best of our ability and that we're supporting you all as a community. We're also going to ask you to do something called a plus delta if you're not familiar with it. What did you love? What did you hate? What worked? What didn't? We talked about this before, but we're going to be putting together a website so that we can get information and materials to you faster. We're hoping that that'll be live next week. It's something that we're gonna host, but it's there for you. And we're also gonna work with community partners who might be interested in hosting some of these other aspects of things that's creating transparency and communication. So we're gonna include a QI cheat sheet coming soon. We have an outreach and communication toolkit. And we have that feedback survey coming your way along with today's deck and recording. We'll send something out when the website's live so that you don't have to worry about getting inundated with emails. You can just go to a single place, hopefully, and get access to that information. Something that came up earlier in our first meeting, we're going to make it available to you guys if it's something that you as a collective want to do together. Which is sort of inventory different meetings that exist and work groups that exist in the community. And we'll try and put some parameters around that, but we'll make it something that everybody has access to and can edit and change and add, so that we can all lean on and work together to maybe participate or to leverage different work groups that may already exist that not everybody is aware of. Emily, did you get a vote on the best background? I don't see anything. 1 second. Okay. Do I need to put it through? I see it on screen here, but it didn't come over. Okay, quickly, if you all have this is in your poll everywhere. Here we go, best background. You can vote. Stephanie, you're getting some kudos here for the best background.
Sorry, I couldn't find my mute button between like taking everything down and then putting it back up. My organization got scrambled, so I had to find my meeting bar. But yeah.
That's quite all right. We'll try and do something fun to kind of close out our time together as well. You know, be prepared. We'll be a little goofy at the beginning of our monthly sessions because they're on Friday, and why not? And we'll hopefully do something fun to close our sessions. I just want to thank everybody for participating today. I know we have a lot going on, and sometimes it doesn't feel like we're getting to the work fast enough. And I know you're all incredibly busy. So I just want to say, I really appreciate you guys making the time. And I'm really hopeful that as we continue to talk and work together, we're going to achieve great things. I think there's already some really great things happening in San Diego. I want to acknowledge that. And I think that those are things that we might be able to elevate and make better as well. Stephanie, I think you're the winner here. So I don't know your address if you're at the office. If you are, please share your address. We have prizes of unspeakable value headed your way for the best background today. So we're going to send you a little gift for the best background. I really appreciate everybody being engaged today. And I look forward to meeting with you again in a month. We'll also, if you're interested in one-on-ones, reach out, let us know. We can get something scheduled. And maybe we can even think about some informal things that we might be able to do to connect more frequently without adding administrative burden. So homework, things to ponder on. But I hope you all have a great weekend. Thanks again. And look out for that survey.
And Denise, I just brought up the community announcements, basically. So
thank you
just
so
wanna
much.
do a shout out to the summit.
Thank you so much, Emily. I appreciate it. Well, anybody is interested in sharing different things that is happening in the community, please let us know. Like I said, we'll also make more time for this in our meetings. But I did want to share this information happening March 22nd. It's before our next meeting. We'll send out some information on this event as well. So you'll have access to that. Thank you so much, Emily. All right, everybody, have a wonderful weekend. I'm going to stay on for 15 minutes after today's session. If you all have any questions or if for whatever reason you want to touch base. So if that's something that you're interested in, we'll be here and we'll hang out and make ourselves available to you. If not, go ahead and drop and have a wonderful, wonderful weekend.
Thank you.
Denise?
Yes.
This is Mary. I just want to thank you I'm truly am an outsider and I really appreciate, I was so happy to get you today because I don't know if you guys noticed how many people dropped that were participants. And you know why? Because that's what I mean. It's a very intimidating topic and situation. And I don't know, however, how many people are on here. I don't want to monopolize your time. But like we have a whole, you know, WIC is across the state and we have a very active advocacy group called California WIC Association. And I was telling them, and we're talking about this because they're encouraging all of the WIC directors to get involved with this at your county level. We need to be heard. We need to get some of this resolved. It's silly. And so we talked about it. And these are people that are smart, really articulate people. And they were so intimidated by their group that, and all the acronyms, they just didn't even know what to say. So first of all, I'm patting myself on the back, but also I just want to thank you because you really made it. I think it was really a great exercise. And I was so grateful to have the people that were in my group in there because, you know, I had some public health people, not just health plan people. So.
Well, I appreciate you sharing, Mary. And I think some of the things that you brought up in the group as being pain points are things that other members of this collaborative can help address.
Mhm.
And hopefully having conversations like this gets you to alleviating some of that pain faster. So I think the other thing I'll sort of say is